incontinence in males is the involuntary leakage of urine. This can occur because of overactive symptoms from the bladder. I treat symptoms of urinary leakage after treatments for prostate cancer and treatments for an enlarged prostate. So that can be in different volumes. You can have lower volumes where someone just wears one pad per day, and patients that are very active and very physically fit but are wearing numerous diapers, this can really affect their quality of life. We have all treatment options available. We have pelvic floor physical therapists that can treat people holistically. We also have very good ways of testing the bladder to see whether this is a bladder issue or a muscle issue. If it's a muscle issue that is predominant, then we can offer surgeries to treat this. There's very safe operations that exist to treat different degrees of urinary leakage. There's very minimally invasive techniques, as well as options to help the most bothered patients. We can do male slings, we can do adjustable balloons, and we've done the most artificial urinary sphincters in the country here. So the artificial urinary sphincter is for patients that have moderate to severe urinary incontinence. And it is indicated to treat patients that have urinary leakage after treatments for prostate cancer or treatments for an enlarged prostate. It's an artificial muscle that we place past your own muscle. So in patients that leak, their own muscle is not effective at holding back their urine. We're adding an artificial muscle beyond their own muscle to help it. There's 3 parts to this device, and everything is inside you. There's everything that's inside the abdomen, the perineum, which is just underneath the scrotum. So there's a pressure balloon as the first part. There's a pump that you place in the scrotum that's very easy to feel. And then there's a cuff, which is like a very fancy belt that we place around the urethra. This is a surgery that has existed for 40 years and has been a fantastic quality of life operation and has helped numerous amounts of patients get their lives back. We also have expertise in treating patients that have had urinary incontinence after radical cystectomy and neobladder urinary diversion. So no matter what your history is, we can help you. I have so many patients that tell me, I want to travel around the world. I just want to go on a cruise. But I want to be able to go on a cruise without packing a separate suitcase full of diapers and protective pads. Because if I go anywhere outside of the US, I just have fear that I won't even be able to find protection. We're trying to restore confidence so people can feel that they're not as limited. We want them to feel limitless